Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Nama Budaya. We are from SGD B4 and this is our student project titled Acute Pericarditis. Here is the group member of SGD B4. Chapter 1, Introduction. Let me introduce myself. My name is Bonifacius Alfianto Setara Pamungkas with last seated of student number 137. So here's our background information. According to estimations, the annual incidence of acute pericarditis in general population ranges from 27 per 7 per 100,000 people, and this indicates that the condition is relatively prevalent. However, underdiagnosis or subclinical instances could mean a larger genuine prevalence. And then the acute pericarditis itself is considerable percentage of chest discomfort, especially in younger person, and viruses, bacteria, and fungi are a few of the infectious organisms that can induce pericarditis or directly infect the pericardium. They can also cause an inflammatory reaction. And also, there are pathway SARS-CoV-2 infection and certain COVID-19 vaccinations, especially mRNA vaccines, have been found to be new causes of acute pericarditis in recent research. And given the foregoing context and urgency, it is critical to have a deeper understanding of acute pericarditis through this student project. So this is the problem formulations. What is the definition of acute pericarditis? What is the epidemiology of acute pericarditis? What are the etiology and pathophysiology of acute pericarditis? What is the classification of acute pericarditis? What are the signs and symptoms of acute pericarditis? How to do the diagnosis of acute pericarditis? What are the complications and prognosis of acute pericarditis? And how is the treatment management of acute pericarditis? And here is the objectives of our student project. To know the definition of acute pericarditis, to know the epidemiology of acute pericarditis, to know the etiology and pathophysiology of acute pericarditis, to know the classification of acute pericarditis, to know the sign and symptoms of acute pericarditis, to know the diagnosis of acute pericarditis, to know the complications and prognosis of acute pericarditis, and to know the treatment management of acute pericarditis. The benefits of this paper is to get a better understanding in the definition, epidemiology, etiology, pathophysiology, classifications, signs, symptoms, diagnosis, complications, prognosis, and treatment management of acute pericarditis.
My name is Fauzan Azimamika Javani with the three last digit of my student number is 131. So pericarditis refers to the inflammation of the pericardium. The primary types of pericarditis are acute, recurring, and chronic. Any of these may lead to serious complications such as constrictive pericarditis or cardiac tamponade. The pericardial disease results from the inflammation of the pericardium, which in turn can give rise to an effusion and rigidity of the pericardium, giving rise to the constriction syndrome as well.
The next slide will be presented by me, Niluputu Mahaputri Kaika, with the last three-digit number 155. Epidemiology of acute pericarditis. The incidence of acute pericarditis is about 27.7 per 100,000 people per year. The hospitalization for acute pericarditis in Finland is estimated to be 3.32 cases per 100,000 people each year, and the mortality rate for acute pericarditis nationwide is around 1.1% in developed countries. Patients of all age can develop acute pericarditis, although it generally attacks men aged about 20 to 50 years old, and there's no racial predilection for acute pericarditis. Pericarditis in developed countries is most frequently caused by malignancy or viral infection.
My name is Remal Prabudianto with digit number 161. Now explain about the etiology of acute pericarditis. Acute pericarditis, characterized by inflammation of the pericardium, arises from a variety of causes encompassing infectious and non-infectious factors. Predominantly, viral infections like Coxsackie virus, echovirus, herpes virus, influenza, adenovirus, hepatitis C virus, HIV, parvovirus, and notably SARS-CoV-2, responsible for COVID-19, contribute to approximately 80 until 85% of cases. However, confirming viral involvement poses challenges due to the often undetectable IgM antibodies at diagnosis. and molecular techniques are invasive and not commonly recommended. Bacterial infections such as tuberculosis and Coxiella burnetii, though less frequent, remain significant contributors. While non-infectious causes include autoimmune conditions, neoplastic pericarditis driven by secondary tumors, metabolic factors like uremia and myxedema, and certain medication, particularly anti-neoplastic drugs, and those inducing a lupus-like syndrome. And recently, two novel etiologies have emerged: infectious, specifically linked to SARS-CoV-2 infection, and non-infectious associated with COVID-19 vaccines, particularly mRNA platforms. SARS-CoV-2 infection is associated with new onset pericarditis in about 1.5% of cases, accompanied by a higher 6-month all-cause mortality compared to those without pericarditis. Similarly, COVID-19 vaccination, notably after the second dose and more common in older individuals, has been linked to a rare occurrence of pericarditis, albeit with an extremely low hospitalization rate. That's all for me. Thank you.
My name is Rusangga Trikira with the last digits of student ID number 199, and I would like to present about the pathophysiology of acute pericarditis. As it was mentioned before, pericarditis can be caused by autoimmune, virus, fungal, and bacteria. Pericarditis that is caused by autoimmune reaction triggered by an idiopathic autoimmune in response to targeting self-antigens that are present in the pericardium. However, viral pericarditis is self-limiting and the most common manifestation. On the other hand, pericarditis resulting from bacteria and fungal infection are typically occurs because of the secondary infection that spreads from other infection in different parts of the body. After initial infection or trigger, the disease course would essentially remain the same. It would set off an inflammatory cascade to the pericardium, such as macrophage that would invade pericardial tissue. Then the pericardium will adapt so that it can dilate to accommodate the accumulated fluid. Afterwards, the pericardial sac will dilate, and it is known as pericardial effusion. And the pressure would change, and then it could create hemodynamic symptoms and can cause life-threatening cardiac tamponade that would lead to sudden cardiac death.
My name is Nyoman Mayana Putra. My last two number is 050. Today I will tell you about the type of acute pericarditis. Acute pericarditis can be divided to a few types. First, there's idiopathic acute pericarditis. This type of acute pericarditis has no known cause. It's often self-limiting and responds well to treatment, with full recovery in most cases. The prognosis of idiopathic acute pericarditis is generally good, with most patients having complete resolution of symptoms and long-term complications. Next is viral acute pericarditis. This type of acute pericarditis is caused by viral infections such as adenovirus, parvovirus, benign, and HIV and various herpes viruses. It's the most common cause of acute pericarditis. The prognosis for this viral acute pericarditis is generally good, with most patients recovering within a few weeks. Next is the bacterial acute pericarditis. This type of acute pericarditis is caused by bacterial infections such as tuberculosis. Bacterial acute pericarditis is still prevalent in most developing countries and can be life-threatening if not treated properly. The prognosis of bacterial acute pericarditis is less favorable than idiopathic and viral acute pericarditis, as it can lead to complications such as pericardial effusion or cardiac tamponade.
My name is Zafira Kumala Dewi with last 3 digit of serial number is 122. Now I will continue the explanation about classification of acute pericarditis. Next is autoimmune acute pericarditis that is caused by complication of autoimmune disease. In this condition, inflammation of the pericardium is caused by the immune system damaging its own tissue. This type pericarditis is usually found in rheumatoid arthritis, SLE, and Behçet's disease. And next is traumatic acute pericarditis that is caused by trauma such as penetrating injury or blunt trauma to the chest. This condition can lead to inflammation of the pericardium, resulting in symptoms like chest pain, shortness of breath, and heart palpitation. This incidence of acute pericarditis following penetration injury is high, with studies showing it can develop within weeks after injury. That's all for me. Thank you.
My name is Carrie Angela, and my student ID number is 2102511116. So one of the most common symptoms is a sudden sharp chest pain that may spread to the neck and shoulders. However, when myocarditis is also present, the pain might be dull and fake. Furthermore, this unpleasant situation may also be pleuritic or aggravated with coughing or taking a deep breath, and positional or relieved by sitting up and leaning forward, and worsened by lying down. This may give the impression that the patients are feeling uncomfortable and anxious. On physical examination, low-grade fever and sinus tachycardia might be found. Auscultation may reveal a pericardial friction rub, which is pathognomonic for pericarditis, And specifically, when this disease is caused by bacterial infections, for example, the tuberculosis, other symptoms such as weight loss and night sweats may also be present.
My name is Franciscus Asisi Tokan. With the three last digit of my student number is 092. So here I'm about to explain about the diagnostic of acute pericarditis. So the diagnosis of acute pericarditis can be made by the appearance of at least just two of these symptoms. The first one is pericardial chest pain, which can be worsened by breathing and also friction rub, and also the finding of ST segment elevation and the depression of PR segment depression. The next symptom is worsening pericardial effusion. Imaging tests such as cardiac magnetic resonance or CMR can also be a great help to detect inflammation by showing changes of the appearance of the pericardium. CT scan can also help to show contrast enhancement and the thickening of the pericardium, which can be used to find any pericardial information. CT scan can also help to find calcification in the pericardium, which are common in chronic constrictive
Is
pericarditis.
Maridanta Widarta with my last three-digit number is 147. So for today, I will explain about the complications of acute pericarditis. So acute pericarditis is typically a benign disease, but in some cases it can evolve into a potentially serious complications. Some factors that can influence this case are the patient's management and also the frequency of occurrence of the acute pericarditis itself. So, complications that may occur in this case are such as cardiac tamponade, recurrent acute pericarditis, and also permanent constrictive pericarditis. But among these complications, among the complications of acute pericarditis, uh, recurrent recurrent acute pericarditis is considerably um, the most problematic because it can reduce the patient's quality of life due to frequent returns to the hospital. Okay, that's all from me. Thank you.
Hello, my name is Gusti Agung Adi Dharma with my last digit of name is right 7. Now I'll explain the prognosis of acute pericarditis. Prognosis of acute pericarditis depends mostly on the underlying etiology. Acute pericarditis that is idiopathic is generally good with a very low risk of sequelae such as constriction, while acute pericarditis caused by bacterial infection, trauma, or surgery is more likely to experience sequelae, and acute pericarditis associated with malignancy has a poor prognosis. Complications like recurrent pericarditis can reduce patients' quality of life due to frequent return to hospital and other complications that can arise from the treatment. Thus, it can also worsen the prognosis of patient. That's all from me. Thank you.
My name is Pursatya Wijaya with the last three digit of student A number 227, and I would like to elaborate more about the management of acute pericarditis. Here are some fundamentals. First, treatment can be done by inpatient or outpatient care depending on whether or not the patients are showing high risk rates, including fever of more than 38 degrees Celsius, subacute onset, large pericardial effusion or tamponade, evidence for myocardial involvement, or lack of response to anti-inflammatory therapy after 1 week of treatment. Second, exercise restriction is recommended. Third, when a viral or idiopathic cause has been found, then treating the underlying cause should be the goal. Fourth, treatment for viral or idiopathic acute pericarditis includes first-line drug approaches, NSAID plus colchicine, second-line drug approaches, NSAID plus steroid plus colchicine, or third-line drug approaches, including azathioprine, IV immunoglobulin, or anakinra. And fifth, if none of them prove to be effective, then surgical pericardiectomy should be done as a last resort treatment. Next, we will focus on the drugs used in first-line and second-line approaches. NSAID. It is aiming to reduce inflammation and pain. Ibuprofen or aspirin has been most commonly used, and if there are notable risk factors or a history of cardiovascular disease, aspirin may be preferred. Colchicine. It has demonstrated the effect of reducing discomfort, increasing the remission rate, and averting recurrences in acute pericarditis. This should be considered if an SIID has not yet proven beneficial after 1 week. However, it has a narrow therapeutic index and should be administered cautiously or not at all in patients with blood dyscrasias, gastrointestinal motility disorders, renal insufficiency, or hepatobiliary dysfunction. Corticosteroid. Early use of corticosteroid has been linked with an elevated risk of recurring pericarditis. Therefore, it is not recommended unless there is a contraindication or if the patient has received no benefit from NSAID or colchicine therapy. That's all from me. Thank you.
My name is Igusilan Agung Libron Dharmalaksana with three last digit of student number R029. I want to conclude our presentation on acute pericarditis. Acute pericarditis is quite common in cardiovascular disease. Generally, this disease is found in developing countries with high cases of viral infection or malignancy that correlate with acute pericarditis. The condition of acute pericarditis is life-threatening if not treated immediately. However, with the provision of immediate treatment and good management, acute pericarditis can be overcome and result in a satisfactory recovery. Okay, that's all our presentation from SGD before. Thank you.